Hi everyone, we're about to get started. Half an hour, one question, one follow-up. I'll turn it over to the doctors now.
Thank you. Good afternoon. Midweek, but still early as far as a lot of the testing things and flow is concerned. So we're going to talk about some of those numbers today, some of the trends and directions, how we're progressing in that line, as well as continuing to look at where we are in preparation with some of the things you now heard announced today, with some other retailers and services being opened up with the containment context of the public health measures still in the pandemic mode at this stage. So before we talk about that, I'm going to hand things over to Dr. Yaffe for today's numbers for this middle of the week.
Thanks very much. So good afternoon. As of 4 p.m. yesterday, 18,722 confirmed cases of COVID-19 reported in the IFIS database for Ontario. This is a slight increase from yesterday. We had 387 new ones. Today we have 412, but it's still generally in the same downward trend. We have 57% women, 44% people 60 years of age and over, and almost 61% people living in the Greater Toronto area. 16% of the cases, or 3,013, are now in healthcare workers. Again, a cumulative number, not representing those currently positive. We continue to see Ontarians recovering, which is great. Almost 71%, or 13,222, have recovered. Currently, 1,032 people in a hospital, which is a decrease of 11 from yesterday, and 219 are in ICU, which is a reduction of 4 from yesterday. Of those, 174 are on a ventilator. And tragically, we do continue to see deaths related to COVID-19. To date, 1,429 deaths, representing an increase of 68 from the previous report. With respect to long-term care homes, the Ministry of Long-Term Care is reporting 174 active outbreaks in long-term care homes. This has gone down by 1 from yesterday. 1,074 deaths reported among residents and 3 deaths among staff. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided to us by the Retirement Homes Regulatory Authority, 68 retirement homes are in outbreak. We have 150 deaths reported among residents. Laboratory tests, total completed so far in Ontario, 365,675. In the last 24 hours, 12,961 tests have been completed, almost 13,000. And we have 8,790 who are currently under investigation. So I'll turn it back to Dr. Williams.
Okay, thank you. And so looking at our numbers, as we said before, we're looking at this overall trend direction. Starting on Saturday, remember we were at a high of 511, and we moved to 434, 370, 387, 412. So it's very slowly coming down, and our positivity rate 5% above, down to 4.5%. So that's hedging gradually down on the overall slope. So those are very positive signs in that regard. The lab test numbers, again, in directions, and as we see every week on the Tuesday report, the numbers are always down because they represent what came in on Sunday, and we saw that a week ago and the week before that, and we're going back up again, and we'll see if we get back up to around our 17,000 or maybe beyond that this week with the amount of testing done in the survey in the long-term care homes, and still encouraging individuals who are symptomatic and concerned to go to their assessment centers to get assessed and potentially get tested in that regard as well. So we're allowing people to do that and to get reassured if they're concerned that they might have contracted COVID one way or the other. We've had the announcements by Premier and Cabinet Ministers on the electricity relief aspect there, but on the other side, the curbside businesses more opening up if they can do so in a safe way with the distancing. vehicles, people taking their turns, calling ahead to find out when, rather than being caught in a large amount of traffic issues, getting the orders and stuff like that. So allowing the retailers, a number of them, to get back into the business, still maintaining the 6-foot distancing on those aspects there, the public health measures, as we are still in the pandemic phase in that regard. Allowing some of the so-called garden centers and the hardware stores that do essential services to be more like in a grocery store modality. Can they work it that way? Again, so many people in the building, pacing it going through there. Some retailers, we understand, are requiring facial covering in some, and each retailer can do as they see fit in that way. And we're still working on some national consensus of how we might roll out the use of facial, cloth facial, non-medical mask, if you may, and some consistency across the country, knowing they have a limited but some value in protection. And as we try to enhance or look at potentially rolling to our first stage of stepping out the pandemic to the next phase of the recovery mode. So again, all things are trending in the right direction. People are staying the course. Mostly, I see on some of our data, people are getting a bit more out and around. I hope they are still continuing to do that distancing, or by wearing facial covering, not to allow close distancing, but to use it when you can't, for those few minutes or so when you can't do so because of mobility, traveling issues, or crowds, etc. So those are the points. So back over to the media for questions at this time. Thank you.
Okay, we'll move to the phone lines. Okay, we'll move to the phone lines.
Your first question comes from Victoria Gibson with iPolitics. Please go ahead.
Hi, Dr. Williams. I wanted to get your thoughts on the same subject I asked Minister Elliott about earlier today around BC's clinical guidance for providing prescription alternatives to street drugs. Toronto's Associate Medical Officer of Health asked the government to consider that and whether it could be adapted for Ontario, as well as considering supporting managed opioid and safer supply programs. Minister Elliott said in response that it may work for BC, but that Ontario has its own plan. In your medical opinion, would there be any value to a program like this in Ontario?
So it's a non-COVID question, which is nice for a change in that sense. As you know, we have been working with a consultation back with the minister, had a number of focus groups and met with them on various aspects. We've been rolling out the funding of the CTSs, going with a much more comprehensive care program, longer service hours, wider variety of components of the programs, and the more enhanced funding and staffing of those facilities in those locations. And even though we've had some, I would say, interruption in that further, because there's still some that are not there in the 21 yet, and so we're still open to looking at some of those in that regard. And we're looking at other programs where they're looking at community-based and different ideas around that would sit and fit more with the structures of our various locations in Ontario. And in that sense, I mean, the unique situation of the down central side there in Vancouver is very unique. It's one of a kind, and they have big challenges there. We don't have exactly that. We have a larger, widespread one in a number of different municipalities, and each one's a little bit different in how we want to offer the program. So we haven't given up just because it's COVID. We continue to work that. We continue to fund. We move PPE into those programs to help them during this COVID time so that program and service doesn't get interrupted. And we're still looking at some other aspects related to further rollout of CTS in some new applications when they come in. But right now people are very much consumed with the COVID issue, and that's another reason to look if we can get under containment control, because we have a whole variety of other public health really important issues, and this one is nonetheless an important issue anyways, and it hasn't gone away. So we want to continue to address that matter in our program that we have been rolling out in Ontario.
Follow-up?
Thank you. And do you think there's anything specific that could help right now while, you're saying that there has been some interruption from COVID-19 to these sites, is there anything that you are encouraging the government to do at this point that hasn't been rolled out in order to sort of help with potential overdoses, help stop potential overdoses throughout this other health emergency?
Well, we're continuing to ask all the CTS sites. Just before we started to get into the whole COVID issue there, we were asking for all their enhanced metrics and data collection because we were trying to understand better. So we're still wanting all that data collection to come in. And we had looked at some other aspects related to some other sites in Toronto and looking at some other partners with some of our very uniquely situated expert centers such as St. Mike's Hospital, how we could look at dealing with this unique and very challenging population in that central part of Toronto, which is different than Vancouver but has some similarities in there. So, and then as I said, there are some still room where there's some applicants for CTS sites to be opened, but I haven't seen any new ones for a bit, and it doesn't mean that they cannot be received. So there's still things that can be done, and we're looking at the various locations and municipalities and centers as they're trying to deal with it and understand this continually evolving picture, and we have not had them looking at that for a little bit in their own respective jurisdictions to say, what is your issue today as compared to before? Because the drug selections, the different things that are moving through the community, the various types of levels of fentanyl, all that, it's not stagnant. It keeps changing, even in the midst of COVID. So we need to be informed of that, and so we can plan our strategies carefully and in a timely way on a go-forward basis.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, doctors. I think everyone is probably pretty keenly aware of the 2 to 4 week period of declines that you're watching for before we move to stage 1. In your assessment, I know we see sort of differing numbers every day, but in your assessment, how long has it been now since we've been in a declining trend?
As I said at the outset, we had back on April the 20th, we were up at 606 high. We're at 500s. Then we thought we were getting down. We hit 500 again on the 28th. We went down a bit below 400. One day dipped below 400, one day only. Then we popped back up over 500, a bit over 500. This week, as I said, we now have stayed down below 500 for 4 days and hedging down with a couple days in the upper threes. So I see this as in this run of coming down, are we in that process? Because we weren't many times over 600, a couple, and that's when we reached our peak, especially back about between April 20, 23, 24. And so we're in a very slow plateau here, and we hope to get even further progression. So I would say be encouraged. We're on the right track. A few little bumps, but let's look at the trend direction. And we're in about day 4 or 5 of this run. But in a plateau, and we're going back a few more days, but we want to see it get really down there and look at that, the so-called R0, that's the transmission rate, get well below 1. And we're just hedging now below 1 average, but there's some parts of the province that are still 1.3, and not always just in Toronto.
Follow up?
I'll follow up. Thanks very much.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, Dr. Williams. Good afternoon. Just a question about retail opening up for curbside pickup on Monday. Just wondering what kind of challenges do you see with perhaps larger numbers of people congregating at some of these businesses if they're kind of excited to get back to normal, with some level of normal? And what recommendations do you have for those businesses to ensure that everyone is properly distancing?
Well, I think we've seen some examples, excellent ones already, that some have undertaken. I think if you're going to plan to do that with your retail business, depends on your location, front door, back door. You may have too many too close together. You may work with your neighbors to say, okay, we'll do this, you do that, so we don't get any problems. You have people do online to say, we have so many people coming from this hour to this hour. We're really too full at that time. Can you come later? and you book your schedules around that kind of thing there. It's easier in some of the burbs because people will probably line up in their cars, but that could be a traffic issue. And then you want to make sure you spread those out over a period of time. So no one wants to sit for 3 hours, so why sit when you know you can actually get a booked appointment to say, come at 2:15 or something like that. So the cars have the advantage you're 6 feet apart anyways, you're inside your vehicle, and then you can just pop the trunk and someone puts something in, you leave and drive off. In downtown Toronto, where people don't have that and people are more crowded, then you're going to have to be more creative and how that's going to work, especially where there's a lot of retailers very close together to each other, and how you go ensure a right flow so you have a whole crowd standing in front, like 3 or 4 lines right beside each other. That doesn't make sense. And you're just one line, you got 6 feet, the other line, you just stand 2 feet away from someone beside you. So it's going to take some creativity, and I think retailers to work in partnership with each other of how to do this and maintain the safety in that and the distancing and not put the public at risk in that regard. And of course, in some centers, you're going to have to have people wearing facial covering, not to say that now I can ignore the 6 foot, just in case the event of a few minutes when you can't maintain it. But there's going to be some creative thinking, and I'm sure that that will come forward with use of technology and apps and things. They can make it work.
Follow up?
Perfect. That's all for me. Thank you, doctor.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, doctor. I'd like to ask you a little bit more about the facial mask. You said that they're potentially working on a national strategy for that. The Premier mentioned earlier that, and he wasn't 100% sure, but in Austria, for example, they were able to reduce the number of cases quite dramatically by people wearing masks, even cloth masks. What literature have you seen, and what evidence or what kind of numbers are you seeing when it comes to effectiveness if masses of the population are wearing even homemade cloth masks?
Well, I know that at the federal provincial table, we are looking at the literature around this and trying to come up with some consistent recommendations around the use of cloth masks. The cloth masks have been shown to reduce transmission from the person wearing the mask to the people around them who are close to them. And so that is what we're looking at in terms of recommendations. But the actual literature is being reviewed as we speak.
Follow up?
No, I'm good. Thank you so much.
Next question.
Question comes from Chris Glover with CBC News. Please go ahead.
Hi there, Dr. Williams. Previously, when we've asked you about collecting socioeconomic data of COVID patients, you've said regardless of things like race, all patients are equally important to you. However, yesterday, I'm sure you saw Toronto's public health officer said she would soon go ahead with collecting race information because she says it will help her prevention strategies. And we've also seen how useful this data has been in the U.S., where we know the virus is not impacting all people equally. And when many public health experts we've interviewed say, well, it's good that Toronto is doing it, this needs to be done at the provincial level to make our overall response better. So given all of this, why is Ontario still not collecting race or other socioeconomic demographic data with COVID cases?
Mm-hmm. So you asked me a week ago, or no, that was almost a week and a half ago, on that issue there. I said we had not seen any tendency or direction in Ontario at this time. As we moved out of the general population into certain priority groups, we already had identified our concern around Indigenous populations, especially those in rural, remote locations. And it was more the geography and aspects there. As we continued to move through, we started moving into the congregate settings. That dealt with a lot more with areas around shelters, homelessness, and with some of the consultants saying, I think we need to start collecting that data because as we start to look at the containment aspect as it moves into that, because a lot of our initial case load in early March, if you recall, after the March break, was people traveling from cruise ships and destination vacations and that kind of stuff, which usually has a certain SES type status to it. and that came in. As that started emanating and going through the population, now we're going to see it as it flow into these congregate ones, and then do we need to have that data? And we're going to be collecting the SES data. We're going to look at the various ways we could or should collect that. Not just for the sake of having it collected, but then how are you going to use that to change your policy and target your programs to deal with very unique ones in unique settings. Racial ones as well. We want to know which ones in Canada are important to us such that they would inform programmatic or policy decisions, but not one of actually encouraging any type of racial profiling in that regard, but more warning people who may be more at risk. And is there any special programs, especially on the go forward, as we relax the public health measures? Even now, we're doing the social distancing, the physical distancing. Most can do that, even with some SES issues and with racial issues. But if you're homeless and you're in shelters, we know already, and some in Toronto have already taken steps to try and remedy that. There's more we can, might, and should be doing in that. But even now, going out further, what should we do on our further containment over the next 6 months to a year to not let that ramp up into outbreaks in high-risk populations? So we are going to be, we are starting to collect that data now and asking for our experts in our areas of health equity, as well as in those other epidemiological groups, say what specific ones in Canada, in Ontario, in different parts of Ontario, should we be collecting to inform our policy direction. So we are doing that now.
Okay. Follow-up?
Collecting. Yeah, when did you start collecting race-based data? Because when we've asked the Ministry of Health this, they've indicated that it's not being done, and they actually said that the Anti-Racism Act excluded health from being able to collect things like race data.
Actually, we haven't quite started collecting it yet. We have been working on the questions that should be asked. And we're just in the process of getting the questions added to the basic questions that are asked by a health unit. They will be questions that will be answered on a voluntary basis because, as you said, they're not included in the anti-racism legislation. So it will be voluntary. If the case wants to answer, they will. If they don't want to answer, they don't have to. But we will be starting that very soon.
Next question.
Your next question comes from Phil Perkins with CHCH News. Please go ahead.
Afternoon, doctor. It's just the one question. Obviously, it's June next month. Kids haven't been in school in a while, but a lot of them are looking forward to summer camps. Is there any situation that you can foresee that summer camps do, in fact, happen this summer, whether they're day camps or overnight, or do you think it's a lost cause?
We've been asked, a number of the different camp organizations have been sending in letters asking. Some are sending in suggestions and ideas. So I think all ideas are worthwhile looking at. As you've heard, there's still the ongoing issue of people going to their second residence, cottage residence, so that's opening up that type of aspect because the long weekend is coming. And I know that's something that the Premier is trying to address in that regard. And so following on that, there are things like day camps in the city, there's outings groups and aspects there. So when we roll down some of the public health measures, what will that allow? What will that facilitate? But as I said, that's like you may be able to with a but or with a caveat. And how does that work? And you can see that some are easier if it's a day type situation where you're going from your home setting in and it's a safe type of thing back out again as compared to the typical camp thing where you're there for a week or 2 weeks with a whole pile of other children and friends and stuff like that. So I think that kind of thing will probably not be possible, but we'll have to look at do they have ideas of how they might do something of some similarity to do activities related to that. And so we're going to have to continue to address that as it goes forward. And as I said, we're getting lots of input and good ideas and suggestions, so we'll continue to take that into consideration.
Follow up?
Well, that's good. Thank you.
Last caller.
Your final question comes from Mo Fahim with Vista Radio. Please go ahead.
Hi, thank you, doctor, and and good afternoon. My question is regarding the report that came out from France, I believe yesterday, that indicated that the first case of COVID-19 occurred in the country as early as December. And then following up on that, the World Health Organization came out and kind of suggested that all countries do some sort of tracing all the way back then to see if there has been cases around before that the January date, I guess. Has Ontario done any kind of tracing all the way back to those dates in order to see if we did have any cases of pneumonia without any clear reason?
I'll try and answer that. We haven't actually done that. I think right now, and I'm aware of that article, and I think that our focus right now is on the go-forward basis and making sure that people are tested, and we learn more about this as it goes along. There is a lot of discussion around doing seroprevalence studies, and if and when we get to do that, that will reflect who has been exposed to the infection going back months. So at this point, there's no plan to go back into looking at who had pneumonia back in December and testing them.
Follow-up?
And my follow-up, I understand that the priority is to kind of deal with the crisis at hand right now. And this is more of I'm looking for your opinion. Do you think this knowledge? What do you think? How do you think this knowledge will change how we view COVID?
So, in particular, you're saying these studies with France and Sweden, correct?
Yes. Well, in particular, how the knowledge of how far back was the first case. How would that knowledge affect kind of our approach?
I guess I'd like to see. I've heard of it. I'd like to see the studies. I think our experts would like to see the studies. What were those samples? What did they do their comparison? What is their, I don't want to get too technical here, but what alleles did they use to do the testing? Is their PCR the same as ours in that? Are they measuring the same thing? Is the sensitivity maybe good, but is the specificity as specific as what we're talking about? So I'm not saying I doubt it. It's just that I'd like our experts to vet it through their review and to see how they may want to do with that. I couldn't rule out that our molecular geneticists, our molecular biologists, and our experts at PHO who have done all the sequencing may not be interested in looking at stuff, but I'll leave that for them because that's in that area of research. And I'd like to know first, how do they review that and how do they assess that situation? So always you want to look and what does it tell you and how best you can answer it before you can say how does it direct your approach and handling of it on a go-forward basis. So I would like to hear what they have to say on the matter.
Okay, thank you, everyone.